All right, we're live. We're here. Hello.
Hello.
Everyone.
Good afternoon, good evening, good night. This is IWR number 5. As always, we are ready. And if you have a tip, if you have something to share, just call or text us, 785-363-5045. We hope to hear from you. Speak from your heart, speak from your mind. We're ready. So I guess, I got something to share. I was reading an article on big league politics, and saw something about this woman named Lauren Witzke, who was talking about children and a trans agenda, and
It's this one right there.
Yeah, exactly. It's that
Cool.
one. Yeah, and so the sort of headline really sort of stood out for me. If you can sort of scroll back to the top, they're coming for your children. And so I sort of went into it. There was like a whole bunch of stuff that sort of was talking about how there seems to be some sort of trans agenda that is trying to sort of come for children, and that there were some talks about laws and gender confirmation, and really didn't understand kind of what the whole sort of the kerfuffle was about. And so thought maybe this is something interesting that we can sort of talk about, because I was confused by it.
Yeah, Duke, I think this came up because, there is a lot of conversation about transgenderism in culture right now, but I think specifically a lot of this is coming up because Dr. Rachel Levine was being confirmed, I believe, for what was it, HHS? Yep. So she would be the first, I think, transgender woman in a position, in a cabinet position like that. And so I also saw a lot about this leading up in the past couple of weeks. And it says here, I saw this meme on Facebook that Dr. Rachel Levine believes that all children should be allowed to select gender and have access to government-funded sex reassignment surgery without parental notification or authorization.
Wow.
So I think that there's this perception or this narrative that's being developed on among some folks that Dr. Levine supports or there's some movement to support gender confirmation surgery for minors, which, I mean, I don't know. It turns. I also saw some things during that confirmation. If you just do a quick Google search about the confirmation, I saw Senator Paul was asking some really intense questions to Dr. Levine about her stance on transgender medicine in minors, like even calling it genital mutilation or something, and trying to get her to take a stance. So it seemed like a really contentious topic. So I guess the question here is there some sort of movement, or does Dr. Levine believe that minors should be able to get sexual reassignment, or I think the term that folks use is gender confirmation surgery, without parental consent? And is this like some sort of major, like, sweeping the nation, everyone is all the children are trying to get gender confirmation surgery or something like that?
I
just wanted to jump in there.
Yeah.
Dude. I think like maybe we should just focus specifically on Dr. Levine and not on maybe focus on her and her voice in this, as opposed to like the voices of like a broader movement, just because I don't think there's a lot of consensus on like specifically what should be done as regards to like legislation around trans individuals and gender confirmation. So it might help us for our purposes just to like really hone in on that.
That's smart. Just like Christianity, and there are a million ways to like approach Jesus, there are like a million different opinions within the left and the trans community about this issue and how to approach gender. So
amen.
So we're specifically asking, should I just take out this first sentence? We're specifically asking, does Dr. Levine believe that minors should be able to get confirmation surgery without parental consent? Is that what we're asking?
I think
Or are we
so.
trying to say, okay,
I mean, I'm open to it being different, but
Yeah, I mean, I think that's a good starting point.
Okay.
It does seem that, like understanding that question, as Amelie has sort of spelled it out, it sort of helps kind of contextualize some of the conversations that I was seeing that were really, it seemed like there was a lot of sort of intensity sort of behind the sort of notion that there may be this sort of agenda that's sort of coming from the top that are, coming after their kids. And so I think starting with Dr. Levine, who's been sort of appointed in this role, would be a good place for us to start and just kind of better understand kind of what Dr. Levine's agenda is in this,
if any.
Yeah.
if any. Yeah, exactly.
Right.
Maybe
Cool.
really
So
wants to be a great like cabinet secretary.
right. That could be the agenda. So maybe we start just by digging in a little bit deeper into what Rand Paul asked her about, and just take a look at that.
Yeah.
Cool. So, well, first of all, we've got these tweets. Amelie, you're the one who I think noticed this. Is there a particular thing that he said that you want us to take a closer look at, or something we can look at?
Yeah, there was something in the questioning. Like if you watch the full hearing, and we could put the link in here. So he does ask folks. He does ask Dr. Levine. Let me see if I could pull it up here. I think there was a Reuters article about it.
Okay. Maybe you can send it to me if you can.
Yeah, for
sure.
sure.
Yeah, I got it. Yeah.
This is actually a fact check, which is interesting, and we can talk about fact checks in a second here. But he asked Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex? And Dr. Levine responds, well, Senator, thank you for your interest in the question, but transgender medicine is very complex and nuanced with robust research and standards of care that have been developed. And if I'm fortunate enough to be confirmed as the Assistant Secretary of Health, I will look forward to working with you in your office and coming to your office and discussing the particulars of standards of care for transgendered medicine. But then Paul says, well, this is a question about minors, and you evaded the question. So he says, do you support the government intervening to override the parents' consent to give child puberty blockers, cross-sex hormones, and or amputation surgery of the breasts and genitalia? And then I guess apparently also earlier in the conversation, he had brought up, compared this amputation and things like that to what he says genital mutilation, which he says has been condemned by the World Health Organization, the United Nations Children's Fund, the UN Population Fund. But it also says in here, if you scroll to like right after the video, it says Reuters was unable to find WHO or UN statements condemning gender reassignment surgery for trans people. If they search for genital mutilation, it was mostly on female genital mutilation. So he compares this transition to genital mutilation. So I think it was just a very intense questioning. I mean, like to call gender confirmation surgery genital mutilation, of course, is a really loaded term, and really intense as it is. And then like to say, oh, do you support children getting genital mutilation surgery without their parents' consent? Like that is really, really, really intense language to be using. And if you believe that, okay, yes, but like that's what you believe, but that doesn't seem to be like Dr. Levine isn't responding to it as genital mutilation,
right? Because
she's approaching this as a matter of transgender medical care.
That's right.
So I think like our question still remains though. She does sort of dodge the question of like, well, do you support this, getting surgery without, irrespective of like, okay, he called it genital mutilation, but irrespective of what you call gender confirmation surgery, she doesn't respond directly. So maybe like we could look again to see if there is somewhere out in the universe something where Dr. Levine does say what she believes. I don't know. What do you think?
So I just want to, I'm thinking about this. I want to just parse this response a little bit, actually, because I think it's a really interesting one. And I'm not in the habit of watching a ton of confirmation hearings because they're boring and people use language like this. But I actually think it's important to understand the context of a confirmation hearing and what that's sort of about and that sort of thing, because I think the lack of understanding of context around confirmation hearings makes it really easy to take certain responses and blow them into these big sort of narratives, right? And so
really good point.
Dr. Levine's like job here is to represent in herself, but also the Biden administration, and to sort of tell senators her views and how she would approach the job. I mean, it's basically a job interview, and so you're asked how you think about different topics. But there's a wrinkle, which is that when you're being confirmed for one of these positions, what you say, you're under oath, and so you don't want to accidentally say something that ends up not being true, or that ends up being so concrete that there are no exceptions to it. And so people often give answers that sound evasive on the surface, but when you actually dig into them, are completely rational and legitimate in terms of applying for these sorts of jobs. I actually think this answer isn't really a dodge. I think what she's saying, or the way I would translate it in plain language, is to say, listen, first of all, she definitely like kind of gives Dr. Paul he is a doctor too, but Rand Paul a sort of backhanded sort of thing here when she says transgender medicine, that's the term she uses, is very complex and nuanced field with robust research and standards of care that have been developed. And what she's saying there is like, this is not genital mutilation, this is not anything like that. This is actually medicine. There's research behind it. There are standards of care, and that's what determines whether you're a child or an adult or whatever else. That's what determines how we proceed in these sort of situations. And so and if I'm fortunate enough to be confirmed as Secretary of Health, I'll work with you in your office to discuss the particulars of standards of care for transgender medicine. So what she's saying is essentially like, hey, don't come at me at the level of calling this something it's not. Talk to me as if I'm a qualified professional, I'm a scientist who understands these things, and we'll get into those nuanced issues. And just to put a very fine point on it, she can't say, no, there will never be an instance when minors cannot make this decision, because it's complex. And there are some instances where minors do need to make these decisions, or where I mean, thinking in the case of folks who are born intersex, and sometimes the point is there's lots of different cases where this has to happen, and as she says, it's complex. So I don't think this is a dodge, really. I actually think this is like the answer you need to give when you're in one of these confirmation hearings, and I think we have to parse it a little bit in that way, rather than allowing society to just sort of blow it out of context because it's not a direct answer to the question.
Well, I mean, as we kind of said, Amelie, like, I think using a fact check as like the basis for this, typically I certainly wouldn't come to this resource for this information, but I think like this particular one does a great job of like contextualizing exactly what you mentioned, Arthur. And the thing for me that I get from this answer, like not engaging with the terminology, is a way of diffusing the terminology, and like kind of what you were just saying, Arthur, it makes it less relevant to talk about it in the terms of the person who's framing it that way. And to frame it as mutilation, as you said, Amelie, is like supercharged, and also it clearly has an agenda. And there's that kind of flavor of moral outrage that just adds a level of charge to this that becomes less about the policy and more about the terminology. And so I think it was actually very strategic to take the question and not engage in the terms. And yeah, that can sometimes look a bit like a dodge, but actually, it removes the use of those types of terms and almost takes it's actually a smart strategic move. It puts you on another foot. It changes the playing field a little bit. So I think it was a pretty shrewd and intelligent move.
I think I totally hear both of your points, and I just want to make it clear that I didn't think like that it was the wrong move to make. I think it was really smart, but I think in terms of just the narrative that's out there and these Facebook memes and these the fact that even Senator Paul was asking it in that way, like using words like genital mutilation points to like a larger maybe fear or narrative or conspiracy that Dr. Levine as a trans woman has some kind of agenda, and that the trans agenda, and like maybe we could look somewhere to see what she actually thinks or about that outside of a confirmation hearing where, yeah, you want to do service to the public, irrespective maybe of your own personal beliefs. You want to like diffuse questions. You want to be about science. You want to take all of the ideas into consideration. And I actually did find, again, it wasn't a fact check from PolitiFact. I know we sometimes fact checks, we don't always like to use them because sometimes people think, oh, a fact check is super biased one way or another. But I think it's really great to just find what people say or like real quotes. And in this one, if you scroll down, you can find that in a 2017 lecture, I think it was at Franklin and Marshall, Dr. Levine describes standards of care for transgender patients and all of that and different health guidelines. But, at one point she explicitly notes, the PolitiFact says, that the guidelines do not recommend any form of medical treatment for children prior to puberty, and for pre-pubertal children or children with gender dysphoria, there is no medical treatment. The idea would be to see a counselor or a therapist who's supportive and has knowledge about these issues and to work with the parents. And then also discusses different, before doctors undergo any kind of physical intervention, these guidelines require the patients to undergo counseling and psychological evaluation. And there's a lot of, just like a lot of steps between a desire to have a surgery and getting the surgery underage. And it appears to be that she says, no, genital surgery shouldn't be carried out necessarily without that consent. I believe, yeah, right?
Yeah, that's what this seems to say to me, anyways, as well. And I'll put this in our document too, so we can take a look at it. But what I love about this is there's 2 things I love about this. One is, first of all, yeah, fact checks, I know people can be suspicious of them, but you're right. This is just quoting this lecture that Dr. Levine gave, and this is super clear that she basically says, no, I wouldn't recommend, this thing that this Facebook meme is recommending her. But we can even take a step back and say, this could apply to any surgery on a minor, period,
Like even if like you're a female, like a person who identifies as female who has a vagina, right? And you want breast surgery, breast augmentation surgery, get bigger boobs at 16 or get a nose job or whatever.
Right.
You still need parental consent to do that typically.
Right.
So
right.
even
if people recommend against it typically too, right? They want, so that makes sense.
Yeah. I mean, so just, well, first of all, as we're going through all of this, it's like, I'm now I don't know if we've all noticed this, but it's like, I'm getting hit with cruises. Somebody asked me about volatility. I mean, the ads are just like, my mind is like real scattered with all these ads.
Totally.
But that's a sort of side point. I guess like to kind of bring it back, just to sort of try to understand this. I mean, there's like quite a bit of like leaps that are being sort of made here, based off of the sort of like situation that sort of happened. And it'd be helpful for me to kind of understand. It's like, even at the sort of very beginning, it's like Dr. Levine, the fact that Dr. Levine is a trans woman, is getting a sort of a line of questioning that maybe a person that didn't identify as trans wouldn't be getting in the sort of confirmation hearing, which
totally.
It's like, okay, so that's sort of happening. And then there's this just sort of like pretty sort of giant leap, it seems, to like implying that because she's trans, that she then must have an agenda to sort of like, push this sort of trans agenda onto children. And And then it's, rather than talking about it in sort of like, more nuanced or sort of more scientific terms in terms of like gender confirmation or sort of like agency, thinking about it through the lens of sort of agency through the individual, it sort of is, and I don't know if this is actually necessarily the like, but when I hear sort of gender mutilation, it feels like to me, it implies some sort of lack of consent. It implies something sort of quite extreme. My sister, I should sort of talk to my sister about that, who's getting her doctorate, sort of studying this specifically. But to me, there are there's just some real kind of like leaps here that then
Yeah.
sort of like, and like bring us back to kind of the beginning of like, the trans agenda, sort of put forth by, sort of XYZ people. And in this case, what we're talking about is sort of Dr. Levine. And so I guess, I don't know, we're sort of teasing some of this out, but like, based off what we've seen thus far, it's really hard for me to start to make a connection between a confirmation hearing for Dr. Levine and the fact that, yes, Dr. Levine identifies as a trans woman, and some trans agenda that is being sort of pushed against sort of the children of America. I mean, it's like, I don't know.
Totally.
To play devil's advocate here, and like, I understand the reasoning behind asking a trans individual who's a doctor questions about their position on, it would be like if you had like, for say, like a specific kind of procedure that was very well known, like you were the first person who ever had, like, I don't know, a face transplant, let's say, and then you're being confirmed, that might come up as something that's relevant to like what your performance of the job might be. So I don't think it's
right. It's like Zach, or Duke, excuse me. You have like a taco agenda. You like tacos, and you must have a taco agenda. Talk to us about your taco
you
agenda.
work for a company, and so therefore, like, you might like tacos more than you like cheeseburgers, and I get that is a line of questioning that would seem that's to some extent justifiable. I think there's like a whole other question I have about why it's all about like why trans equals genitals all the time. Like, I don't get that.
Yeah.
Because as I understand it, it's like your belief, your feelings about your own gender, and like confirming that with yourself. So like, I don't know why we always have to talk about genitalia, but I understand why, and I can see the relevance to asking questions about this particular point to this person in the context of being a like public figure who's going to be making medical decisions for the country. You know what I mean? Like, or making a policy rather choices. So I kind of, that's legitimate to me. But I do agree with your point, Duke, about like, why are we not using medical terminology? Why the medical terminology isn't being used when they're talking to her in the very like hallowed and very like specific context where like everyone's super well educated and doctors in their own right? Like, why are we using the terms mutilation and not some more scientific medical terminology? And also, like, again, like the hidden agenda aspect, like,
Right.
I understand it. Dr. Levine is not hidden about being a trans woman. So what, like, there's no, I'm kind of like.
Also say that, Senator Paul is not hidden about being religious either.
Right.
So in some ways, if there is this narrative that there is some sort of trans agenda that is assaulting, traditionally conservative views of gender, like people born with penis are men, people born with vagina are women, and like that might, having a trans person in a very visible public role for him might threaten that very traditional notion of gender. So I think like the language that he uses is incendiary because in some ways, like, yeah, there is a political agenda. The political agenda is a certain conception of gender, and he's going to use non-scientific language for certain things because that is part of his
Right.
narrative and his
Right.
agenda.
Right.
So
And
I think like that there is a really big narrative there as we as a culture work out what gender is and what gender is to certain groups of people.
that's right. But I think what's important, or what's really important to understand about that is actually, and I think this is a common tactic that we see, is that, what is this really about? What is this activity, all of this conversation and all of this debate and all of this panic about, we started this with an article that says they're coming for your children, which is obviously, we've just shown that that's not even close to true, and it's a ridiculous question to begin with. But why are we having this conversation? Is sort of what's on my mind. And I think, Amelie, that you've hit it, that there are people with an agenda in this place, and it's people like Rand Paul, and that's fine. I mean, they can believe that gender has to be this way. I think personally, I believe that science has shown us that gender is actually very complex and much more much less binary than we typically assume. But there are people like Rand Paul who believe that that there are only two genders, and it's determined by what you're born with, and that's that. And the point is that they're using this confirmation hearing as an opportunity to advance their agenda of stopping any conversation about what gender is, or turning the conversation to what they want it to be. And they're creating all of this hysteria and just fake stuff out of this, and they're using this as, it's very opportunistic and it's very manipulative. And I'm actually like forget the politics of it and forget the the rest of it. Like, I'm kind of mad that he's so shamelessly using this as an opportunity just to generate outrage, when in fact, when we looked at it for 10 minutes, there's no there. And that's what I'm coming to. So I don't know if you guys agree with me or have other finer points on it, but for me, it's like there is an agenda here, and it's coming from Rand Paul.
Well, I have to, I mean, so this is from that Big League Politics article that I talked about, and this is a quote. This is a quote from Lauren Witzke on this. Is that this is where we are in society, and guess what? They're coming for parental rights. They've already stripped parents of their rights to protect their children from gender transition. It was always about the children. That was always the goal. In a matter of 10 years, we have went from, oh, we just want to get married, to, oh, if you don't let us chemically castrate our kids, we're going to throw you in prison. And this is where we are at. And they called us crazy when we talked about the slippery slope. But the agenda was always the children. She added, calling for legislation to protect children and their parents from the transgender menace. And it's like, I mean, I just really struggle with this, because it's sort of, it jumps to all of these conclusions. Like the narrative that this paints is that the government is going to implement a widespread trans agenda that is going to strip parents of their rights as legal guardians of their children, and is going to influence young people that are vulnerable, or that have set up a condition where children are vulnerable and don't have are influenced into, in Rand Paul's framing, genital mutilation, but just sort of broadly speaking, to sort of put it into this context where it's like conflating all of these things and sort of bundling it all into this sort of just like really simple narrative that there's a trans agenda. Dr. Levine is just is evidence of this trans agenda. And if we don't act now, they're coming for your children. I mean, it's like, come on, let's actually just slow down here a little bit. Let's take a deep breath and let's just actually discuss this. I mean, it's like, we're just going to pack everything into this narrative. It's about parental rights and children's rights and gender mutilation and the conspiracy of the government. I mean, it's like, whoa. Can we just take a walk in the park? I mean, and go on a cruise. I mean, there was ads there. If we go to these articles, there's a cruise. Yeah. So it's just bring it down. Let's just pause. Let's talk about this for a second. It's just it's really grabbing the bull by the horns in a big way to sort of just take this confirmation hearing. And so that's, it's helpful for me to see this all sort of laid out in this way, and to sort of use this fact checking, who are folks that are doing this work to sort of try to kind of pull out these threads and to be able to have a conversation where we can sort of go into the sort of nuance of this and sort of understand, where we align and maybe where we differ, but to sort of make the point that it's this, this trans agenda, and to associate that with Dr. Levine, and to say, to go around and really just scare a bunch of people, because like we're taking time out of our day to sort of talk about this, and it's like, it's scary. Like, I'd be scared if like someone was coming for my kids, it's like, that's a scary thing to sort of put in front of people. And so that's all. It's just like, let's just,
Dude,
So your takeaway, Duke, like, calm down.
What'd you say, Emily?
What's your sort of final thought to
Yeah.
I mean, it's, I don't think that Dr. Levine has a trans agenda to sort of come after people's kids, and that we should all just sort of pause before we start throwing bombs. Like that's my summary. Yeah, take a breath somewhere in there. Pause, calm down, stop throwing bombs, and take a breath. That's my
Great.
summary.
Love it. Amelie?
What's yours, Amelie?
Yeah. Well, I would just say too, like, the pace of social change has, certainly grown, and groups and people and identities that were on the margins, 30 years ago, are now like living their lives more freely and fully without, so much. I mean, there's still lots of fear out there, right, of harm and crimes against trans folks. But they're living out, and you can be a assistant secretary of health as a trans woman. But what I would say is, like, as fast as that's happening, maybe the pace of conversation hasn't caught up in every circle. So I would say, yes, society has been moving fast in some ways, but also we need to slow down the conversation, much like you, Duke. So like, society moves fast, but let's slow down the conversation so that we all understand more deeply that people aren't out there to take your kids away, or to or to get some sort of surgery that is really life-changing without really thinking it through first with science and evaluation. So like, society moves fast. Let's slow down the conversation so that we understand there's not an agenda, and then really figure out what is, going to be best for people so that they can live their lives the most fully and freely. Without some, that's what I think about all of this.
Cool. I'm just riffing on what you said as I go, but I love science. Trust the science. Figure out what's best for all people. That's awesome. For me, and then we'll let Emily maybe close. For me, that's what I said earlier. I think it's like there's an agenda, but it's to make everyone terrified for no good reason, right? Like that's the agenda, right? It's not to take your kids. It's actually just to like try and turn this into a moment of moral panic, and moral panics happen all the time. Like rock and roll is gonna come for your kids and kill your kids, and before that, like, I don't know, Coca-Cola was probably coming for your kids, and before that, whatever.
UFC, like,
right, everything's
cage fighting.
Exactly. And it's never true. But there are people who, like Rand Paul, like to get up and beat their chest about it, who are opportunistic, who have, who knows, money or power or whatever on the line. And yeah, so that's my takeaway. Emily, what do you got?
I mean, my answer to the question of whether Dr. Levine believes that minors should be able to get gender confirmation surgery without parental consent is just no.
Right.
But I think the thing that I find the most interesting, like, trans issues are not Republican Democrat issues. There are trans Republicans like Caitlyn Jenner who are very vocal Republicans, and then there are trans Democrats like Dr. Levine, and it's a people issue, not a party issue. And so while I understand that there's, and I agree with you guys that there's there's a lot of like hand raising, and like this is a confirmation hearing and it's very charged, changing of the guards always like that. The thing for me is like, we should just get back to the fact that this is like a people first issue and this isn't a party issue. And I understand that Dr. Levine's presence might provoke this moral outrage, but the reality is that, you know, the confirmation questions and the confirmation positioning is like whether this person's going to do a good job, and like that's the question that we should be really focused on. So
That's
yeah,
a really
Wow, y'all are great. Yeah, y'all are
that.
great. Yeah.
Yeah.
I mean, go ahead, Amelie, please. Yeah.
No, just one final thought. Like, I just want to say that yes, there are still very traditional people like who adhere to certain religious creeds and approaches. And some of those people are Republicans, and some of those people are Democrats, and some of those people are not politically engaged at all. But they maybe really do care a lot about their, you know, their notion of that. So, you know, maybe Senator Paul is trying to get those people on board with him and represent their voice. And we can't ignore the fact that there are folks like that in this country. And we need to be like, everyone needs to have a conversation in good faith about that too. So I just want to like sort of like put a coda of like religious or conservative folks who have a traditional notion of gender exist, and we need to have conversations together in good faith about how to move forward and make policy, because that's, like it or not, that's the country that we live in. And
I love that.
We got to move together. We got to move together forward on it.
That's right. And
Yeah,
underline the in good faith piece of that. Sorry, dude. Go ahead.
No. I was just gonna say, I just, you know, I love that. Like, I really do choose to believe that people are good people, you know, and as y'all are going through this, I'm just thinking about like life, liberty, and the pursuit of happiness, and just sort of like what, you know, what that's about, and you know, I just, it's nice that we're bringing like an air of calm and sort of an awareness that like these are complicated issues, and you know, I'm grateful to spend this time with y'all, and that we get to do this, because it's I learned through it too. Bring us home, Arthur. Give us a fine point.
Well, no, all I was going to say, I love what Amelie said, and I think that is important to realize. But I think the key, and again, I keep going back to this, I think the key is in good faith. And it's you know, like we have to learn how to live together. And I think what we're learning increasingly, the more we do this, is that a lot of what we're seeing is not in good faith. I think that the jumping to conclusions is deliberate. It's deliberately manipulative. It's you know, meant to make this into something that it's not. It's meant to scare people and scare people into certain beliefs, and you know, that's bad. But if we can have if we can find a way to sit down together and do what Amelie said, and have that conversation, again, underlining in good faith on all sides of an issue, that's what we got to try for.
I hope you don't mind if I close this all out and just say that
Please.
it is unacceptable if you're not having these conversations in good faith and you want to harm folks for living their lives,
Totally.
hurt them physically or spiritually or morally. Like that's wrong and illegal too. You shouldn't be going out and physically harming folks because you're trans. That's awful,
totally
bad, and illegal and wrong.
Yep.
So I want to like put that point out. Like, you can have these arguments in good faith, but if they're not in good faith and harming folks, no.
Take a cruise.
Yes. So take a cruise, sit down, and like go to first premises. Don't be harming folks for who they are. Okay.
All right, y'all.
That's IWR number 5. As always, call or text 785-363-5045. We're here for you 24/7 with any thoughts, tips, ideas, or conspiracies that you might be picking up on out there. So give us a ring.
Awesome. Thank you all.
Bye-bye.
Bye.